My name is Tyler Wells, and I'm an education coordinator with the Indigenous Health Program. I'd like to welcome you to today's presentation of engaging Indigenous peoples and communities to improve health outcomes as part of the Indigenous Health Program's Telehealth Learning Series. To begin, though, I'd like to start with a territory acknowledgement, and I'd like to credit one of our presenters, Val Austen-Wiebe, with this. I'm using her territory acknowledgement. So I think it's so good, and I also think that it shares the reason for the territory acknowledgement, not just as a simple procedure or a sort of box to tick at the beginning. So I think it's a great model to follow. We begin by acknowledging that we are on traditional lands, referred to as Treaty 6, Treaty 7, and Treaty 8 territory, and all the people here are beneficiaries of these peace and friendship treaties. This territory is the home for many Indigenous peoples, including the Blackfoot, Cree, Dene, Saulteaux, Ojibwe, Stoney Nakoda Sioux, and Tsuut'ina peoples, and the Métis Nation of Alberta and the Métis settlements. We respect the treaties that were made on these territories, we acknowledge the harms and mistakes of the past, and we dedicate ourselves to move forward in partnership with Indigenous communities in a spirit of reconciliation and collaboration. So today's session will have two separate presentations by Brenda Laboucan and Val Austen-Wiebe, and I'll be introducing them both at the beginning of the session. So Brenda Laboucan is a Cree woman originally from Kelly Lake, BC. Today, Brenda and her family are active in the Indigenous community through activities like powwow, where all members of her family dance contemporary powwow styles. Brenda and her family also consider themselves a hockey family, and on weekends they can often be found in one of Edmonton's many arenas. Brenda has worked with AHS since 2011 and is currently the Indigenous Engagement Advisor for the Indigenous Health Program, where she is primarily responsible for the Wisdom Council, a provincial health advisory council. Val Austen-Wiebe holds master's degrees in foods and nutrition and educational psychology, as well as a certificate in community development and quality leadership from Intermountain Health. Her education is complemented with extensive and diversified work experience in the Manitoba and Alberta healthcare systems, including supporting the development and implementation of the Indigenous Wisdom Council for AHS. In her spare time, she likes to paddle. So without further ado, here's our first presenter, Val Austen-Wiebe.
Good afternoon, and thanks everyone. I hope you can hear me. So this is the acknowledgement that Tyler has provided to us. And I just wanted to really thank you for being here today and for listening to the story of what I call the journey of the Population, Public, and Indigenous Health Strategic Clinical Network. It's a story of many committed and caring people who've come together within the SCN to share, explore, discuss, and create innovation and transformational work to improve the health of Indigenous people in Alberta by working together through ethical space and in the spirit of truth and reconciliation. And so the agenda that I'd like to share with you today really describes the approach that we took within the Population, Public, Indigenous Health SCN, a little bit about what our transformational roadmap looks like today, some highlights of some of the actions that we have underway, and then of course at the end there'll be an opportunity to have questions and discussions, and that will be after Brenda has the opportunity to present on the Wisdom Council. So I wanted to share this with you, which is AHS's commitment to close the gap in health outcomes by working with Indigenous partners to co-develop and implement transformational changes. And these changes are driven by the community priorities and their social and cultural needs. And this is the ideal that Alberta Health Services has committed to and continues to strive to do. In Alberta, the magnitude of chronic conditions and health disparities among Indigenous peoples are a reflection of the complex issues, including, but not limited to, the jurisdictional and legislative issues that affect the current state of healthcare delivery in this province as well as across the country. The kind of programming and access to service issues that many Indigenous people face, the absence of Indigenous-centered and targeted programs that really address the needs that our Indigenous people have, and the limitation in research and health data on our Indigenous peoples that can help us to understand how to move forward in the best possible way. So I thought I would start off by just, for those who don't know what strategic clinical networks are, is just sharing a little bit about what they are and what their purpose is in Alberta Health Services. And they've been around for about 5 or 6 years now, and I'll show you a slide that shows all of them and how our SEN is related to those. But a little bit about why networks. First of all, they're there to provide an opportunity to really look at innovation and knowledge translation through a joint decision-making approach to improve health outcomes for our patients and our families. And one of the ways that we can do that is to look at the variation in the ways that we practice healthcare delivery in our systems and look at that variation, because reducing the variation oftentimes will lead to improved quality. And the quality improvement is a really foundational part of what SENs are driving to achieve. They also help to solve very complex issues. Sometimes when we look at healthcare delivery systems, they involve many, many partners and players. And we want the SENs are actually able to bring all those partners and players together to one table to really look at how we can design care that actually can make the difference and improve outcomes. And we also can look at it from an equity lens, because we do know that those who experience poverty in our province are more likely to have very poor health outcomes. And so we have to look at it from that social determinants of health lens and understand how we can do things from a different perspective than just really trying to look at everybody as being the same, but really trying to address that. And I'll speak to that a little bit further in the presentation. And that all partners need to be involved in planning and improving the healthcare delivery system. And from a health equity perspective, that's nothing about me without me. So it's trying to include all the voices and all the perspectives in the planning process. Networks can help scale and spread innovations that have value across our organization, and they can also develop research from a team-based approach because they are a networking model. So this diagram really strongly shows the strong position for influence and advocacy that the population, public, and Indigenous health SEN has with all the other health SENs. So you can see that in the center of the diagram is really the objective around a healthy population and high quality care for patients and families. And then surrounding that is the Primary Healthcare Integration Network, which is a brand new SEN that's just been, which has started in September. And then the Population Public Health, that's one of the core committees within our Population Public Indigenous Health SEN. There are two core committees, Population Public Health and Indigenous Health. And so today, what I'd like to talk about is the Indigenous Health SEN and share with you a little bit about that journey. So again, this diagram also just shows that, through the identification of problems, concerns, issues, variations in care, we then look at what kind of interventions are happening out there, what's best practice, what are others doing. We can develop interventions and test those interventions to see how well they might be working for certain populations, and then looking at how to measure and monitor those and evaluate them for success, and then begin to spread and scale those to other parts of the system. So that's really how SENs work. So this slide just shares with you not complete pictures of all our SEN members, but pretty good snapshot of the many members that we have within the SEN. And what you may or may not be able to see from that photograph is about half the population of core members that are on the core committee come from Métis or First Nations communities. They're either working in professional capacity in our system through their life in an urban environment, or they're from the First Nations or the settlements. And we're really excited to have such a great diversity of individuals and expertise at the table. So that includes primary care providers, academic researchers, specialist care providers that work in acute care sector, We have health directors from some of the nations across the province. We have the Métis Nation of Alberta as a representative. We have many people from the Population, Public and Indigenous Health SCN. And we also have some elders from some of the communities within Alberta. And we partner very closely with the Indigenous Health Program within the Alberta Health Services. So we have, I think, a pretty robust group of people. And what I'd like to do now is to go back to almost 2 years ago. In May, we launched our SCN, and I'd like to take you through the journey that we took them through a little bit by just highlighting some of the key features of what we talked about. So we started off by talking about healthcare as a treaty right, and that Treaty 6 includes the medicine clause that says that a medicine chest shall be kept at the house of each Indian agent for the use and benefit of the Indians at that direction of such agents. So we need to remember that this was back in 1876, and so the language reflects that terminology at the time. There's other clause that was also included that included that pestilence and famine would also be addressed as part of this treaty signing. And that was really important to the people and to the agreement that was reached. And we also needed to talk about the nation-to-nation relationship. And that we're not really, this isn't just about another population group out there, that this was really about a relationship from a nation-to-nation perspective. And that we were all representing a nation that wanted to have relationships and move forward in a way that respected and valued the nations that we were working with, from that place of their ability to self-determine their needs, to move forward from a place of autonomy and control over the services and programs that are delivered, and to work in that collaborative space of partnership that was outlined in 1763 in the World Proclamation and the Canadian Constitution again in 1982. So this slide was presented, and this was actually one of our the leaders in the Indigenous Health Program who talked about we need to change the story. And so that became very important to us as we thought about what we're really trying to do here. So after 150 years of government policy, we need to move things different. And this was said by John A. Macdonald in 1887. The great aim of our legislation has been to do away with the tribal system and assimilate the Indian people in all respects with the other inhabitants of the Dominion as speedily as they are fit to change. And so the same boat was, denial, economic growth, wealth, profits. So on the backs of all of that, it's really, we need to move forward with a new story. We need to move forward with a new relationship. We need to recognize the treaties. We need to acknowledge that they were based in peace and friendship. We need to acknowledge that we're working together with nations who have a right and who are the original inhabitants of this land. And so we also, again, wanted to reflect on what are the reasons for poor health. And this Health Council document of Health Council of Canada in 2012 did a whole review of what was happening for Indigenous people. And this quote, many Aboriginal people don't trust and therefore don't use mainstream health services because they don't feel safe from the stereotyping and racism, and because the Western approach to healthcare can feel alienating and intimidating. So in terms of changing the story, we were very aware that colonialism has played a foundational role in the development and maintenance of the Canadian nation state. And research papers such as the one you see beside in this slide explore the role of racism in the health and well-being of Indigenous peoples. And this was a very hard and difficult concept to talk about in the beginning. I think a lot has happened to actually make that term racism to be more understood, that this is a foundational and important thing to be talking about. And the racial slur that happened over the summer and the work that our executive did was outstanding to address that and to begin to help us as an organization move forward and embrace the fact that, again, not to shame or embarrass or in any way leave people feeling in a negative way, but to just honor and respect that this is happening and we are all part of the solution to move this forward. So in terms of health equity, we also looked at that as well. And oftentimes health equity is sort of seen in these three boxes. One is that there is factors such as colonialism, poverty, racism, housing, access to food, access to healthcare services, all those kinds of things that leave some people less able to get what they need or to see what they want to see in front of them. So we can put in place some kinds of remedial factors that will help eliminate some of those, and that's good, but it's not exactly where we want to go. We actually want to change the system so that it doesn't matter where you come from. You don't have to have special adaptations or things done necessarily, but you have full access just like everybody else, and you don't need to have specialized services. So we know we need to work in both models and perspectives, but we really want to help everyone understand that it really is about looking at the system as well as looking at the individual in terms of the kinds of responses that we want to make. So armed with all of that, we went forward to develop a transformational roadmap. And simply speaking, this is what we did. We looked at who are we in this room or in the core committee and who support this work, and where are we now? What are we trying to do? What are we trying to accomplish? And how are we going to do it? And how will we know when it's done? So that's the kind of journey that I want to talk about now in terms of what we have moved with. And one of the things that we started with was to develop our mandate. And in the center of this slide is the mandate that we were given by Strategic Clinical Networks, which was to improve population and public health, innovate to improve quality in disease and prevention of disease, address variation, equity, and disparity in care, explore cross-cutting improvement, and integrate strategic research. So that's what we were given. And of course, we looked at that from both the population and public health side as well as the Indigenous health side, and we couldn't rest there. We knew that we had to move differently. And embracing that as our understanding of what our foundation was, we created what value, what additional mandate do we bring to the SCN table and to Alberta Health Services. Population and public health was advanced innovation in population and public health, because that's what their expertise and that's the work that they do, focusing on upstream solutions and building community capacity, and population level improvement through participatory and applied research. Not to suggest that we're the only ones who do this work, but to suggest that this is a real foundation of what we bring to the table. In Indigenous health, we recognized very quickly that the Truth and Reconciliation Commission calls to action were a necessary foundation to improve health outcomes. We could not move forward without the dialogue and the deep thinking that needed to go into that as an organization and as a province. We also recognize we need to use traditional approaches and ways of knowing to advance our understanding, and as part of what we have learned from the elders that spoke with us of creating ethical space so that we can actually create the understanding, not to move Indigenous ways of knowing into our ways or our ways into their ways, but to create that parallel understanding of what does it take to really create a unified way forward that doesn't create cultural confusion or doesn't create enmeshment of ways. So we really began to listen to that and understand that's how we had to move forward. That engagement was a primary foundation and a nation-to-nation approach. So when we were taught about this from Elder Reg Crowshoe, he talked about their Western knowledge systems, and we, for those of us who work in these systems, we understand those. And we had to create the parallel between traditional knowledge systems, because what he described to us is that we'll find those parallels, that they're there and they've been there from time immemorial. And what we try to do is overwhelm those traditional knowledge systems with our knowledge systems, and it doesn't help create the kind of space we need to ensure that we move forward from that place of reconciliation. So he talked to us about ethical space and helped us understand how we can begin to do this. And so in changing the story, we also recognized that we needed to work differently. And I know you can't see this, so I'm going to unpack it a little bit for you. But I present this to you to just share around the ways in which our SCN is working, and that is to create artifacts or graphic recordings of the kind of dialogue and discussion we have so that we can use these as our touchstones as we move forward. So again, it balances out a Western approach to documentation and writing and so on with a storytelling methodology that is very much in alignment with our SCN and our colleagues and our partners. I just wanted to start off to say, we started with the roadmap, and I described that a little bit to you. And it was really important that we document this roadmap. So we looked at the kinds of things we wanted to do, and so you'll see change strategic goal to close the gaps in health outcomes of Indigenous people. And we had a voting process on that, and we also used dialogue, and we had a bit of an understanding of how we needed to make that move forward. So this is just a reflection of that kind of work and how we documented that. We also knew that reconciliation was a key focus. And so again, honor and respect the Truth and Reconciliation Commission of Canada calls to action, and the United Nations Declaration on the Rights of Indigenous People. For that, that became reconciliation. And again, these were terms that were brought forward from our Indigenous colleagues who are working with us to say, we don't want to talk about, we want to take action, we want to move forward. We also recognized that we needed to go slow to go fast, that we needed to nurture and understand each other, that we needed to take affirmative action, because that's one thing we learned along the journey is we need to act, we need to get going. These problems that are faced by our Indigenous people are serious, severe, and they have a huge impact on the people. And we need to begin to do things and do things in a way that makes the difference. But we have to do this by creating the story and telling the story. And so hopefully I've been able to capture that today a little bit for you. We need to bring people together because that's what builds trust. And it's that ongoing relationship development that is going to make the difference for us in the long run. So this is our transformational roadmap today. You can see there are guiding principles and values, and I've tried to share some of those with you today. I'll let you go through them just in the interest of time. We also have enablers like ethical space, two-eyed seeing, addressing racism, those kinds of things. Our mission is to improve the health and wellness of Indigenous people by engaging Indigenous people as equal partners in their own health, wellness, and care, exploring and identifying and embedding equitable, holistic, and culturally safe health practices, and acknowledging and addressing the health inequities rooted in the determinants of health. We have 3 strategic goals: truth and reconciliation, transform health services and systems, and address the determinants of Indigenous people's health. So just a couple of highlights. I spoke a little bit about the Truth Always, which was the senior leadership coming together to address their understanding of Indigenous people's health and to look at reconciliation and what needed to be done to move forward. They had a blanket exercise and did a number of learning opportunities to listen to the elders and to share stories that had been taking place in Alberta Health Services, and to also formally start the apology with the Kainai First Nation around the racial slur incident. There's also been, over the past year, AHS listening days, and this has been spearheaded by AHS People Strategy, and the reason is because the Truth and Reconciliation Commission of Canada calls to action actually ask us as an organization to begin to address some of the human resources issues that we are facing in Alberta, and so the HR folks are very committed through the People Strategy to develop a good response. And they've started by developing listening days, and those listening days are to listen to Indigenous people in AHS who want to share their story and tell their truth. And so they've spent a year doing that, and it's been a very profound and emotionally moving experience to be part of. The continuum of cross-cultural safety, there was an AHS executive leadership program last year where one of the teams was asked to focus on this whole idea of cultural safety. And their presentation is a profound reminder of what the current state is for racism in our system and the current state of Indigenous people's health. And if you ever have a chance to take a listen to it, it's well worth it. We've hired an Indigenous scientist and a research associate. Well, we're actually in the process of the research associate. And we are looking at, or we've started the development of an Indigenous PACER internship. PACERs are patient and community engagement researchers. They're patients and families who are trained to do engagement research through the University of Calgary. And we've just embarked on that whole adventure, and it's been quite an enlightening and an exciting opportunity. So I just wanted to share a little bit about you, or with you on that. The first, second phase have been completed. So we had almost 100 people attend, all Indigenous people, attend the orientation sessions in Calgary and Edmonton. From there, we had about just over 40 people come together to do an intensive theory training opportunity at the University of Calgary. And from that, we hope to see at least 25 participants move forward to actually become trained PACERs over the next 2 years and develop their own research project, which will have ethics approval and be working within the SCN to develop that over the next two years. So this is just a map that shows you, we asked all of those who came to the orientation to put their dot on the map in terms of where they came from and where they have influence with Indigenous peoples as an Indigenous person. So I think this just shows you how much of a breadth and depth that we actually had of individuals stepping up to say we want to participate in this, and it was a real exciting kind of opportunity. And so with that, I thank you very much for your attention. I apologize if I went a little bit over time. Thank you again, and look forward to hearing from you all.
Before I begin, I'd just like to acknowledge a creator, those who passed before us and those who will come after us. I'm sitting here with Marty Landry, and before I begin, I just want Marty to do a quick introduction of himself because he's going to be helping me whether he knows it or not.
Good afternoon, Marty Landry. I'm one of the managers with the Indigenous Health Program, but I'm also the Director of Indigenous Health at Alberta Health under a secondment, working with Alberta Health and Alberta Health Services. So I'm working with Val with some of the stuff that she's working on the SCN, and definitely working with the Indigenous Health Program and Brenda with the initiatives that are taking place. So
Awesome.
Thanks. Welcome.
All right, so thank you, Val, for your awesome work. I think what I'd really like to elaborate on before we begin with the official Wisdom Council presentation is a huge thank you to Val, because Val was the Executive Director of the Indigenous Health Program when the Wisdom Council came into its inception. So the first slide, I'll get you to move over to the inaugural meeting date of September 25th and 26th. So this is the first meeting, the official meeting of the Wisdom Council. We had all of the new membership come together in Edmonton, and we met for 2 days. We actually had the opportunity to meet with Dr. Chris Eagle, and I think it's important to note that one of the first issues or concerns, however you want to coin it, the Wisdom Council brought to Dr. Eagle's attention was racism, and that is one of the priorities, one of the top concerns that the Wisdom Council always, wants to bring forward. And it's like Val said, it's not with the intent and ill intent to make anybody feel bad, but I think when we open up sensitive issues such as racism and put it on the table, I think that gives us an opportunity as a system and as people to grow. So if I could get you to go to the next slide, Tyler. Our Wisdom Council is a health advisory council, and it's actually a provincial advisory council. So I'm not sure if people are aware of the health advisory councils, the provincial advisory councils that are based with community engagement. Wisdom Council was placed, but because of its unique nature and its need to communicate directly with the Indigenous Health Program, the Wisdom Council shifted from the community engagement into the Indigenous Health Program shortly after its first meeting in September. The Wisdom Council is a little bit different from the other advisory councils as we report to the President and CEO. So we've gone through a few, and right now we're in a really good spot in terms of stability with our CEO and our leadership. Dr. Yu actually attended the Wisdom Council prior to being the President and CEO when she was the lead for the People First strategy. So we had an existing relationship with Dr. Yu. So the Wisdom Council reports to the President and CEO, and they provide guidance and recommendations on the design, delivery, and evaluation of province-wide, innovative, and culturally appropriate Indigenous health programs and services. And it's important to note that it's a provincial, it's not a political body. We do not dive into issues around treaty rights. I think it's really important to note that because we do have leadership like chief councils, M&A, MSGC leadership that's in place to take on those political discussions. We have, currently it's a 20-member body, but currently we have 13 members. Recruitment will take place, and I'll speak to recruitment a little towards the end. Our membership, even though it says Wisdom Council, and our natural thought process might lead to this Wisdom Council being an Elders Council, it is not an Elders Council. The membership as a whole wanted to honor the First Nations elders, the traditional knowledge holders, the Inuit elder that are on, and just the expertise and knowledge that they brought to the table. So when there's a question around, is this an Elders Council? No, it's not. The name Wisdom comes to honor those who are considered elders on our council. Next slide, please, Tyler. So the purpose is to provide guidance and recommendations to Alberta Health Services and to draw upon Indigenous traditional and cultural knowledge and practices. And like Tyler said, this will be available for you to review, so I don't want to do too much reading, but rather speak to the processes that are in place to approach the Wisdom Council if you do want to have input on a strategy, programming, or that sort of thing. So what will happen is the chair and the vice chair are responsible for the agenda items. What usually happens is a strategy such as the People First strategy will approach the Wisdom Council with protocols in place and ask in a culturally safe way for advice and guidance on areas that will affect Indigenous health across Alberta Health Services. Next slide, please, Tyler. As you can see, the council mandate is to provide the guidance and recommendations on those bullets. Again, improving access, cultural competency, relationship, health literacy, communication strategies, traditional healing programs. Next slide, please, Tyler. Our objectives, again, is to review and provide guidance on system-wide priorities, adaptions, approaches to ensure equitable health. And I think I keep saying it's important to note, but it is important to note that the Wisdom Council is an advisory council. So they are not operational. When it comes to delving into the operational piece, they hand that off to the Indigenous Health Program. So in the future, you will be able to access the annual reports and the meeting summaries, all the information on the Wisdom Council on the Alberta Health Services website. I'll get Tyler to share that information in the new year, but that website, that link actually will have the annual reports, and in there you'll see the message from the chair and vice chair, the biographies of our members, the feedback to the Alberta Health Services partners that we've completed within the year, the knowledge sharing that we've done with different ministries, different programs outside and inside of Alberta Health Services, and of course the work plan. So recruitment's a little bit unique to the Wisdom Council, as a lot of people in the North don't have access to stable internet. So when it comes to formal recruitment strategies such as using social media, things like that. The Wisdom Council does do that piece, but it's more when we do recruitment, we more rely on word of mouth. So currently, our members who signed on as the first, this is going to be a little bit complicated, but half the Wisdom Council signed up, committed to a 2-year term, the other half committed to a 3-year term. When their first terms were completed, they had the option to sign on for an additional 3 years. And what we're finding right now is that our members, half of our members are coming to the end of their final term. So a formal recruitment strategy, an Indigenous-friendly recruitment strategy will be underway in the new year. So the chair and the vice chair are selected for membership. Currently, right now, Casey Eaglespeaker is the chair. Dr. James McCocus was the chair, but he resigned at the last meeting, so we're in transition right now. And if you look in the three circles, you have who is on our Wisdom Council. Currently, we do have 2 youth. So the Wisdom Council had made a commitment to really give that youth voice. Stephen Bureau and Tyson Tallman are currently our youth. And I use the term representative very loosely because the Wisdom Council is not representative of Indigenous groups. It is not representative of political bodies, but rather Indigenous people coming forth with their own experience within the health system who feel that they could provide that advice and guidance to Alberta Health Services. When the Wisdom Council first started up, Val did a lot of work. She approached many First Nations organizations, Indigenous friendship centers. She went to treaty councils. She went right across Alberta to garner all these names. So that's a quick snapshot of the Wisdom Council. They meet 2 to 3 times per year. They primarily meet in Edmonton to keep travel on the minimum for our elders, especially for those elders traveling from up north. I think that's all I have right now. Is there anything that you'd like to add, Marty, that you think I might have?
Sure. I'll add if you can hear me. The Wisdom Council, there's a long-standing history of the concept of the Wisdom Council. And that started way back, maybe over 25 years ago, within the Edmonton zone. Capital Health Authority established what they called a Wisdom Committee. And then when the Alberta Mental Health Board took over services for mental health in the province, they created a Wisdom Committee as well, based on the model with the Capital Health. And then at the same time, Calgary, the Calgary Health Zone had an Aboriginal Health Advisory Council that was led by Indigenous people within the Calgary Zone area. So the model a little bit different, but nonetheless it was still a representative body for that particular area. So the concept of bringing people together as a voice is a long-standing concept, and I think that's what makes it unique, because it's different than a tribal organization providing a representative voice, or a political body, or the Métis Nation, or that sort of thing. And that allows us to talk about the issues that are topical to individual people within the province versus, political health issues, or health issues that become political at the First Nations or Métis level. Not that we don't deal with those kinds of situations, but we do within the Indigenous Health Program. But at the Wisdom Council level, really is the voice. And then one other thing to add is that the uniqueness of the committee is this ability to engage in cultural processes. So Val talked about ethical space and this ability to honor protocol and various things like that. We do that, and we do that behind the scenes, and we do that at the actual Wisdom Council meetings. But the idea is to be able to create opportunities for each of the respective elders or traditional knowledge holders to participate and guide us and teach us in terms of protocol and processes that they think are important to to the committee and to Alberta Health Services to understand. So in Val's slide, when it says, in the slide that Val had where it said slow down to speed up, and that's an example of how the Wisdom Council operates, this idea of taking a step back and being able to really ensure that proper protocol and processes are in place, especially for the elders that practice that. And that's a good learning experience for us as a system, and that's the processes that were used by the other wisdom committees in the past as well. So it's good to see it continue.
And some of the discussions that the Wisdom Council have focused on include traditional medicine use opportunities, so supporting the inclusion of traditional healing methodologies and programming within Alberta Health Services. So it goes a little bit deeper than just cross-cultural care. They speak of Indigenous midwifery, the importance of self-identification, which can be kind of a sensitive topic. As we all know, Indigenous communities don't have the greatest relationships with institution, whether that be justice, health, education. So when we start gathering data around who are the people we're serving, are we being effective in serving, and there is a bit of distrust. So the Wisdom Council is there to provide that guidance and that advice on how to move forward in those approaches in a good way. Culturally safe care is another Wisdom Council priority, cross-cultural education, Indigenous accreditation, increasing Indigenous staff within the Alberta Health Services. And I think one thing that I'd like to add is that they were a big push behind having an Indigenous representative on the Alberta Health Services Board, and that actually came to fruition with Heather Hirsch. A lot of the work between the Wisdom Council and Val's program intersect. The Wisdom Council and Val still have to determine how we're going to work together so that, if people aren't familiar with what the work Val's doing and familiar with the work the Wisdom Council is doing, they might actually think it's a duplication of services, but that couldn't be further from the truth. We're two totally different programs that are working in Indigenous health. So I think that's all I have right now, Tyler.
Thank you, Marty, for your contributions as well before we do that, because I found that particularly interesting myself. And so the first question is, how does one get in touch with the Wisdom Council now to receive guidance on an initiative that is occurring right now?
So the easiest way would be to get a hold of me, and you could find me under Global, Brenda Paul Laboucan. There's another Brenda Laboucan in the system, and she gets really irritated when she gets my emails. So if you could find me under Global, under Brenda Paul Laboucan. And unfortunately, in the new year, I will no longer be with the Indigenous Health Program. I'm moving over to Human Resources. So there hasn't been a person identified within the Indigenous Health Program, but I will continue to receive the emails and forward them to Nadine McCree, who's the Executive Director of the Indigenous Health Program.
Yeah, we're definitely going to miss Brenda, and I know that there's a couple of things I'm hoping to finish up in the short amount of time she has left, so I'd encourage you to try and contact her as well while we still have this terrific resource with us, where she's tackling on a new part of AHS's efforts to reconcile with Indigenous folks. So I'm just going to go to a second text question really quick, and then we'll open it up to the sites. So the second question is the Wisdom Council to be utilized just for province-wide initiatives, or are they to be used for specific initiatives with individual nations?
I think what I heard was a difference between federal program and provincial programming. So if it's a federal program that's outside of Alberta Health Services and it's a First Nation funded program, I would direct them to the First Nations federal partner. But with the Wisdom Council, I think it would have to be provincially funded or Alberta Health Services funded programming. That's where I see the Wisdom Council fitting in, providing that guidance and feedback. I hope I answered the question correctly. Yeah,
and we all know how to follow up on you clearly, not to send it to the other Brenda Laboucan. So also, I just want to remind you that Val Austen-Wiebe is still here, and I would love to get 10 or 20 minutes.
There are 10 minutes remaining in this video conference session.
I would encourage you to take that opportunity because she's very busy, and will soon be leaving for another meeting. So if there's a site out there, Al, if we could take the force mute off just in case that hasn't been done yet. And we'll wait to see if there's someone who would like to ask a question at one of the sites around the province. Oh, we have a question here at Southport. I think there's good microphones in the room, so you can ask where you are, Anne, if you'd like.
Okay, perfect. I didn't hear the question.
Well, yeah, it would be great if you would come out just so I think that would help people stay engaged with the session.
Yeah, thanks, Anne, and thanks for the question. I think that as we move forward in the learning, so the Pacers will have online components, but they're also working in teams, and they're working in those teams from the local areas, either their community, so Gift Lake, or I think it's, whether they're working in Kainai or, Siksika. They'll be working in those teams of people and really trying to learn together. So that will bring knowledge, I think, of what the communities are experiencing. Then their actual research or project work will then be targeted back to their communities. So whether this particular PACER is focused on cancer prevention and screening, and so that can be quite broad, actually, and it could even look at traditional approaches to healing and those kinds of things. But they can then focus on really exploring through engagement research with their communities, what are the things that are important to the communities? So that'll bring a lot of rich value, both to the SCN, but also to AHS as a whole, and which is why it's so important that we actually partner with the Indigenous Health Program for sure on this work, and we certainly are doing that, but as well the Wisdom Council and others, so that we can share that learning, share what they're saying. We're looking at some exciting things to do with this work with the Pacers, and one of the things is there are Red X talks, like TEDx talks, but these are Red X talks. And so in September, we're working with Cowboy Smith and that whole, I can't say the word, sorry, I haven't practiced it enough, but the name of their organization, which is guided by the initial treaty pipes ceremonies that were held back in the 1800s. Those same traditions are guiding this work around Red X talks, and they really want to focus on medicine and health. So our thoughts are to bring the Pacers to share their stories, to share their research, to share their ideas there. So I think there'll be all of those kinds of opportunities to take advantage of the fact that as an SCN and as the Indigenous Health Program begins to really ground and develop themselves, we're starting to make those connections and build the bridges to greater opportunity.
Well, thank you very much, Val. We do have another question in the room, and is it for Val? Is the question for Val or for? Oh, okay, go ahead.
I'm trying to understand how that group connects with all these other pieces. So just trying to understand all these groups that we're supposed to meet with or present to or that type of thing.
Okay, so the question was about the Indigenous Integration Committee and just how that connects with Wisdom Council and I guess the SCN. I wondered if who should be the best person to address that, Brenda or Val?
Tyler, okay, I can answer that.
Okay, so just before you begin, Marty, I just want to say thank you to Val Austen-Wiebe. She needs to head out to a local community. We've held her and gotten a lot of terrific information from her. So Thank you, Val. And so if you have any other questions just in the last few minutes of the session, they can be towards Marty and Brenda, and I'll let Marty address this last question.
Okay, thanks. I think if I understand the question, then how is the connection to the Indigenous Integration Committee connected to all of this? The Value Mental Health Report was established, and the report came out, I think, last year, 2 years ago. And there's 4 integration committees. One of them is focused on Indigenous mental health and addiction, so there is an integration committee established for that. And the other ones are complex needs and addictions and children and youth. But there is one specifically focused on Indigenous addictions and mental health. And each of these integration committees has identified as leads for action items stemming from that report. And we have 2 specific ones, but we're also working on action items that other integration committees are connected to. So there's a number of things that we're doing. And we have representation throughout Alberta. We have representation from some of the tribal organizations, rep from the Métis Nation of Alberta and Métis Settlements General Council, and then internal within the government, as well as external through AHS. And I think we have 1 or 2 Indigenous serving organizations that are on the committee. Right now, our connection with the Indigenous Health Program is through partnership or through representation. So we have members that are on that committee. And then, but in terms of representation from the SCN, we don't have anyone specifically on that committee that represents the SCN, but the people that are on from the Indigenous Health Program sit on the SCN core committee. And there's nobody on there that's from the Wisdom Council. And we haven't decided as a committee in terms of our connection to such groups, because there's elders groups, there's the Wisdom Council, and there's other significant areas out there that we need to figure out how to connect with. It's still a fairly new committee, started this year. The other ones were a little bit older. And so we are asking those questions ourselves. And but there's nothing definitive in terms of its connection to the Wisdom Council yet.
Thank you.
Okay. Thank you very much, Marty. We only have about 3 minutes left, and so I'm actually going to thank Marty for his ad hoc contribution today. Thank you for being available and sharing all your knowledge, and thank you to Brenda for all the time and commitment you put in to share about the Wisdom Council. I think that's something that a lot of people were interested in about, and I think we made some progress in ways to get more information and not just knowing more information about it. So I want to thank you very much for your presentation today, Brenda. And I want to thank everybody for their interest and support, and we will see you in the new year. And if you are interested in getting credits as part of the Maintenance of Certification Program of the Royal College of Physicians and Surgeons in Canada, give me a email and I can help out with that. Have a great day. Bye.